Good afternoon, everyone, and thank you for joining today's session as we navigate the final week leading to your MRCOG Part 1 exam. I know this is an intense time for you, and many of you might be feeling the pressure, which is completely normal. Before we begin today's session, let's take a moment to connect. So please tell me, how's your preparation been going so far? Okay, so most of you feel confused and nervous, and that absolutely makes sense to me. So, how all of you are coping up with the pressure? Okay, so remember, you have come so far, and this is the final stretch, and it is all about the final tuning and what you have already know. And trust me, you are much better prepared than you might feel right now. So, feeling nervous, confused, and things that comes to your mind, like you don't remember anything, and everything is vaporizing from your mind. That is absolutely normal. So one more thing, who feels confident about anatomy, or is it everyone's weak spot? And what is the most challenging thing in anatomy? Why it is still your weak part? Yes, Dr. Imad, blood supply and nerve innervation, that is indeed the most volatile part of this curriculum. I can relate with everyone. So I think everyone feels like they have forgotten everything. Is that right? Okay, so let me give you some reassurance. Trust me, this is just the pressure talking. It happens to everyone, and if you can go through from the chat, everyone feels the same way. So that is another reassuring thing. That usually happens even at my level. Whenever I'm going to write any exam, I still feel the same way. So that is absolutely normal. Trust yourself, and your brain will recall everything when needed. For instance, when you are solving paper, yes, for now you need to remember each and every blood supply, but in the exam you will face hardly 3 questions from that domain, and ultimately you will remember the things that is actually needed in your exam. So don't worry, just relax yourself. You just have 1 week left for the exam. So the purpose for today's session is to just give you some tips that would help you in the last week of preparation. And definitely, if you have some confidence in yourself, if you follow the right tricks and tips, then definitely you will ace your exam in your first attempt. So let's begin. Yes, roughly 4 days. Okay, so in today's session, let me give you an overview. First of all, we will start from the discussion of the confirmation email you will get from the person. We will discuss about the exam day essentials. I have the exam interface of the Pearson. I will show you so that during your exam you don't get panic. And at the last, I will share you some tips for the final week. Yes, that's great. Okay, Dr. Jitendra even counts the minutes. Okay, so most of you will already get this confirmation email. Please do let me know in the chat box who have already received this email from the Pearson. That's perfect. So most of you have received this email. So what you're going to do with this email, you need to check your email for the confirmation for the Pearson email. Once you have this email that most of you will already have, you need to verify your exam date, time, and venue. Make sure that is correct. Ensure your account details, that your name, your all the details are correct in that email. So you need to cross check that. If you find any discrepancy in your appointment details or with your actual details, do contact the Pearson immediately. So this is your email, this is your appointment details, and you need to take a screenshot and get a hard copy of this confirmation email. Is everyone following me? Okay, below this, your appointment details, they have given the details, what things they are expecting on the exam day. So these are the important things you need to read carefully. You must arrive at the test center at least 15 minutes before your scheduled appointment time to complete the necessary check-in procedures. Well, I mostly recommend to reach 30 minutes before the exam. That would help to ease your stress because many of the students they just panic before the exam. They have that tachycardia, that shortness of breath due to anxiety and exam stress. So try to reach 30 minutes before the exam so that you have plenty of time to relax at the examination room. So what things you need to bring with yourself? Okay, it varies. Well, 30 minutes time is more than enough. Try to reach 30 minutes before the exam. So what you need to have, you need to bring your original ID. It might be your passport, it might be your national ID card. So these things, the original one you need to take with yourself. Dr. Sangeeta, don't worry. You may get your email maybe by tomorrow. Okay, what is the purpose of the early arrival is that once you enter in the Pearson Center, they will confirm your identity. You need to make some signature there, and those signatures should be similar to your passport or your ID card. So make sure you do the right signature. Once they confirm your identity, they will check in the system. They will offer you the exam details, like what things you need to follow, the exam rules and everything. You need to sign that. And once you do these initial checks, then you can wait for your turn or for the time for the beginning of your appointment. So what to expect on the exam day? I'm going to provide you the insight uh, what can be expected from the Pearson test centers on the day of your exam. So mandatory items you need to bring, you need to carry with yourself is your valid photo ID, maybe your passport or your government issued ID card. confirmation email or booking receipt, which you received in your email. The items which are strictly prohibited are your bags, books, notes, mobile phones, smartwatches, and electronic devices, which also includes the calculator. That means calculator is not allowed. I received many questions from the students, and they were inquiring about the calculator because they are nervous about the biostatistic calculations. So there is no calculator allowed in the examination room. But they will provide you with the sheet and a marker. You can do your calculations on that. Before entering into the examination room, they will offer you some lockers. You can put your bags or your watches, your mobile phones in that locker, and you can keep the key with yourself. So what would be your exam timetable? And I'm sure everyone is aware of that. The exam consists of two papers, each with 100 SPAs. Both papers contribute equally to the final score. Your first SBA paper, paper 1, duration is for 2.5 hours, that is 150 minutes. Number of questions 100, and same goes with paper 2. And a special note is that between your paper 1 and 2, you will have a 1 hour break. It's optional. If you want to take a break, you can, and if you don't, you can straight away start your paper 2. But I would recommend you please utilize this break so that you don't feel burnout during paper 2. So please make sure you utilize this break. Maybe you can take 15 minutes break or 30 minutes break, or maybe for 1 hour. It's all up to you. But it is recommended. Yes, Dr. Farina, that the normal range is usually written in the exam questions. So once you enter into the examination room and you are sitting in front of the computer, the first thing which would appear on your screen is the login credentials, which are usually entered by the person. They have those credentials and they will enter the email address and the password on your system. There is no need to remember your email address or your passwords or your login details. It is classically done by the Pearson people. The second thing, once the Pearson coordinator will enter the email address and the password, you will see an introduction screen. First of all, they will provide you with a demo, which is for the 5 minutes. In that demo, they will guide you how you can operate the system, where are the navigators and everything. So take your time and read general instructions and rules. Time will not detected. Watch the demo video. It would take up to 5 minutes. And after 5 minutes, that demo video automatically goes off. So the next thing you will see your question interface, which exactly looks like this. This is a demo exam interface. On the right side, is the screen visible to everyone? Okay, that's good. So if you can see here on the right side, on the top right corner, you will see your time. Just below that, there would be number of questions. And just below that, in front of this arrow I have marked, is the flag for review. For instance, if you are solving this question and unfortunately you are not sure about the answer, you can simply click on here and this question would be red flagged. On the right lower corner, you can see the navigator, next and the previous. This is something which is very usual with everyone. You click on next, the next question will come. If you want to go on and jump onto the previous question, you can simply click on previous, so you will go back to the previous question. So this is how your exam interface would look like. So the timer again displayed on the top right corner, then center is your question area, the navigation buttons, next and the previous, and on the right corner you will have the flag for review. Here I have zoomed this. Then at the end, once you solved all of your questions, you will see a review screen on which there is a summarized flagged questions, unanswered questions, and completed questions, and the end of your test. And now you have that review screen. If you want to go back to your flagged question, just click on that question. you will be directed to that question. Same goes with the unanswered questions. And once you review your question, then you need to click on the submission, and your your paper would be done. Am I making sense to everyone, or do I need to repeat anything? Okay, here on the right top corner is the flag for review. Okay, Dr. Lubna, this is your exam interface. This is a Pearson exam interface. Uh, uh, the center area would be your question area. On the right corner, on the topmost, you will find your timer. Below that, there would be number of questions, and below that, you will have flag for review. So for instance, if you are not sure about the answer, you can simply click on here. This would be, this goes red. And at the end of your exam, for paper A, after 100 questions, you will get a review screen on which the questions you have flagged would appear. The questions you left unattempted would appear, and the questions you have attempted also appear on the review screen. Is everyone clear about the exam interface? Okay, so I was wondering to ask you this question. Let me read the scenario for you. A 20-year-old woman presents with a foul-smelling vaginal discharge that has caused severe genital irritation and postcoital spotting. She reports multiple sexual partners and recent unprotected vaginal intercourse. Speculum examination is shown below, which is the single most likely diagnosis. Your option A is cervical ectropion, B cervical cancer, C PID, D candidiasis, option E cervicitis. Okay, so your time's up. I wanted to ask a question. How would you differentiate between cervicitis and PID? Because most of you answered pelvic inflammatory disease. Well then, the correct answer is C. It is cervicitis. It is not PID. Okay, please tell me, how would you differentiate between cervicitis and PID? Okay, uh, this scenario is about female. Okay, I will give you the answer. Let's come back to this question, why E is the correct answer. In this speculum examination, the cervix appears inflamed, friable, with a thick purulent discharge coming out of the external os. So this is most likely cervicitis. Why not it is PID? Because in PID, the difference on the physical findings between cervicitis and PID is the pelvic pain. So if in this particular scenario, if they have mentioned about the pelvic pain as well, then yes, you can opt for PID. However, the ultimate complication of cervicitis is PID. So again, what is cervicitis? Basically, it is the inflammation of the cervix characterized by the purulent endocervical exudate or easily induced endocervical bleeding caused by manipulation with an atraumatic instrument such as cotton swab. Clinical features, history, dysuria associated with vaginal discharge, dyspareunia, intermenstrual or postcoital bleeding. On speculum examination, this is classical for cervicitis, is friable inflammatory exudates from the cervical os, tender on digital examination or swab use. Strawberry cervix appearance is consistent with trichomonas vaginalis infection. Okay, so what happens? Cervicitis, there are different causes of cervicitis. It could be infectious or it could be non-infectious. So that means it may be due to chlamydia, it may be due to trichomonas, or it may be due to gonorrhea as well. So easily induced cervical bleeding is suggestive of chlamydial infection with a positive predictive value of 40%. So what could be the infectious causes? No organisms are usually identified, but if an organism is isolated by culture, it is most often Neisseria gonorrhea or chlamydia. Non-infectious causes could be due to vaginal bacterial overgrowth, local trauma, malignancy, radiation, chemical irritation, vaginal douches, systemic inflammatory disease, or idiopathic inflammation. And the management of cervicitis is usually due, according to the causative organism. If it is due to gonorrhea, the management is according to that. And if it is due to chlamydia, then management is according to that. And same goes if it is due to Trichomonas vaginalis, then we will manage cervicitis according to the causative organism. Okay, if you look at the other options, cervical ectropy, and all of these topics are very high yield. Make sure you know a bit about each of one. For example, you should be knowing what is cervical ectropion, what is cervical cancer. There are many questions from cervical cancer, like according to the causative organism, there are many questions from herpes virus. Then we have a pelvic inflammatory disease, candida infection, and cervicitis. You should be knowing the pathology of all these conditions. They are high yield. I have added a slide on cervical ectropion as well. What is cervical ectropion? It is the presence of columnar epithelium on the ectocervix. It is known as ectropion or ectopy. And on speculum examination, this is how the cervical ectropion looks like. It appears as a red patch at the center of the cervix, so it is very easy to diagnose. It occurs due to, why it happens? It occurs due to increased exposure of cervical epithelium to the estrogen. The cervix increases in size because of the influence of estrogen, so therefore it occurs in adolescence, pregnancy, women taking hormonal contraceptive pills, and ovulatory phase of the menstrual cycle. Is everyone clear? Please do remember, sometimes in your exam, they simply ask you the definition of cervical ectropion. So please remember, it is the presence of columnar epithelium on the ectocervix, which appears as a red central patch on the colposcopy examination. Okay, so someone asked me to show the exam interface again. So this is how your exam screen looks like. Dr. Rukmini, the passing percentage usually varies on each exam, but the usual range is from 68% to 72%. Okay, so I'm going to share some tips since you have 4 days left for your exam. You need to do some focused revision strategy. And why it is the key? Because the final week or the final few days, they are very crucial for cementing your volatile and high yield topics. Smart revision improves retention and boosts your confidence. So I have shortlisted some topics. Those were volatile for me. Maybe it varies from person to person. So you may modify these topics according to your need. So in general, from anatomy, what you need to just quickly revise is the blood supply of key organs, nerve innervation of the pelvic region and perineum, lymphatic drainage of pelvic and genital structures, and pelvic measurements and diameters. So this is something which is volatile, and when I was reading your answers, all of you were confused regarding the same topics, like all of you were confusing the blood supply, nerve innervation, and lymphatic drainage. And trust me, you will definitely get questions from this domain. Then from physiology, just have a quick overlook on the hormonal regulation of menstrual cycle, like what hormones are going to increase during the first half of cycle and what hormones are going to decrease or increase during the last half of the cycle. Then physiology, pregnancy and lactation, just a quick look. Acid-base balance during pregnancy and fetal circulation shunts and their postnatal changes. This is a very high yield topic. There are four major shunts, and you need to remember which shunt is converted into which postnatal structure. Then from biostats, the key formulas for sensitivity, specificity, normal predictive value, positive predictive value, and odds ratio. Make sure you know how to draw to X2 table. And yes, please try to remember, along with the formulas, try to remember the definitions of these, especially the sensitivity and specificity. Then types of data, what is nominal data, ordinal, interval ratio, statistical tests like chi-square test, t-test, ANOVA test. Then understanding the p-values and confidence interval. And I'm sure you will definitely get questions from this under these topics. So don't skip these. Then from embryology, development, quickly revise the development of renal and reproductive system, timeline for fetal organogenesis, derivative of germ layers from endoderm, mesoderm, and ectoderm, common genital abnormalities like Müllerian anomalies. Okay, what other thing you can do? If you have made your flashcards, you can review them. If you have made some mnemonics, you can also revise them. For example, there is a common mnemonic, water under the bridge, which is for ureter crossing under the uterine arteries. Then another thing you can do in the last few days is to attempt full-length timed mock exam. And while you are solving the mock exam, focused on the accuracy and the time management. These two things are important. Analyze your incorrect answers and revise those concepts. Limit resources, stick to your core notes, and avoid new material. This will definitely, if you do such things, like if you start reading some new study material or new notes, that definitely gonna make you panic. Pitfalls to avoid: starting new topics you haven't studied yet. Don't do that. Don't start a new topic. Spending too much time on non-volatile subjects. Overloading with excessive information. So this is absolutely not recommended, because now you need to relax yourself. Don't try to study extra information or very deep knowledge, because ultimately you will get saturated. So the night before exam, you need to pack your essentials, sleep early, and avoid cramming. On the exam day, stay hydrated but avoid too much caffeine. While solving your exam, read all the questions carefully. Make sure you know, are they asking about the yes question or the no questions. Then flag your doubtful question and move on. Don't spend too much time on thinking on the same question. So simply red flag that question and move on. The general tips are staying calm and confident during the exam. Remind yourself of your preparation, deep breathing exercise to stay calm, avoid last minute topic discussion, and build confidence by solving easy questions first. So again, this is worth repeating. When you are solving your paper, try to solve easy questions first. And if you are not sure about the answer, just red flag that question and move on. And at the end, you will have plenty of time to review those flagged questions. Okay, so someone asked me how much questions will we have to get correct in each paper. Okay, so there is not exactly a number of questions you need to correct in the exam, but make sure you should, since it's a percentile system, So your performance would be compared with the rest of the candidates. So there is not a crystal clear or cut-off value. You need to make those questions correct. But yes, try to do your best in the exam. Okay. Dr. Farhana asked me what are the other high yield topics. If you have any particular subject in your mind, you can ask me so that I can shortlist some topics from that. At least you should be solving more than 60 questions correct for your exam. This is the minimum value. Okay, from pharmacology, the questions are not very difficult. Usually, they just simply ask the straightaway questions like, what is the mechanism of action of that particular drug? Maybe they will ask you the mechanism of action of antiviral, antifungal, or antibacterial. The other thing is you should be knowing the guidelines of anticoagulant management during pregnancy. And the third thing from pharmacology, you should be knowing the contraception. Okay, Dr. Absha, I have already shared a slide. You need to carry your original ID card or your passport, the printout of your appointment details, and that's it. These two things are mandatory. Dr. Maham, it all depends on your luck because the selection of questions are random. Because every time it varies. Sometimes in some papers, only just 3 or 4 questions comes from biostats, and in other exam, there might be 8 to 10 questions from biostats, and same goes with the other subjects. However, the clinical management in which the CTG comes, that is a high yield topic. And overall, the portion of clinical management is more as compared to some simple subjects like microbiology or any other minor subject like immunology. Okay, if you don't have your passport, you can bring your government issued ID card. Okay, for CTG, I would advise you to go through from the guidelines. At least you should be knowing a minimum that you are able to interpret the CTG. Is it assuring or non-reassuring? Okay, from the microbiology, the syphilis is important, the torch infection in a nutshell. The torch infection, they are important. You should be able to diagnose which type of infection it is. The other thing is human papilloma virus, their variants, the vaccines, and yes, the classification of the virus. These topics are important. And yes, the vaginitis, the types of vaginitis, you should be able to diagnose, is it candidiasis, is it bacterial, it is, or is it parasitic, and a bit about the management. Yes, if you find a question of ABGs, they will give the reference range. Dr. Ishwarya, it is all about the luck. Sometimes there are many questions which are similar to the previous exam questions, and sometimes not. And sometimes what they do, they just simply just twist around the clinical scenario, but the options and the answers or the basic concept of that particular question is the same. Yes, recalls are very important. If you have time in the last 4 days, you can quickly go through from the recalls again. It would definitely, it is going to help you. Okay, Dr. Jaspreet, in clinical management, there are not many conditions we need to manage. There is just a very precise list, and all of that topics are important. Like you should be knowing the management of hyperemesis gravidarum. You should be knowing the management of different genital infections, like how you're going to manage PID, how you're going to manage chlamydia, how you are going to manage gonorrhea. So these things are important. Then endometrial hyperplasia, that is important. How you're going to proceed with the patient, the management of heavy menstrual bleeding, that is important. There are many questions from that domain. Yes, the 5 year recalls are enough. And the biophysics, it is a minor subject. There you might get hardly 3 to 4 questions from biophysics, maybe. Dr. Freena, I have already told this, that there is not we cannot predict how much percentage is going to come from the recalls. However, the topics, the core concept which is already asked in the previous exam would be similar. However, they will just simply change the statement, but the topics would be similar. Dr. Sangeeta, 5 year recalls is more than enough because the pattern is similar. Okay, so the key is definite. Someone asked me, do they have a pet answer for a question or they pick from the maximum answer? No, it is not the case here. The answer would be fixed and they have an accurate answer and you will be marked on the basis of that key. Okay, from biochemistry, you need to know the difference between glycogenolysis, gluconeogenesis, so glycolysis. These three things are very important. However, I remember when I was taking a lecture on biochemistry, don't remember which lecture was that, but I used to say to my students that in what I have observed in the previous exam questions, that they usually ask a question from biochemistry, specifically from the cycles, from the different metabolic cycles. They either ask the initial step or the final step. So if you don't have any time to go through from the very details or all the steps of the different metabolism, try at least to know the first step and the last step, or if there any exceptional point in that particular cycle, that is more than enough. Because they have covered all the cycles in the previous exam, but the trend was the similar. Either they might be asking the initial step or the final step. Yes, the rate limiting step, that is important to know. Yes, the normal values, the reference range would be provided in the exam. Yes. So someone listens to me carefully during my lecture. I'm glad to know that. Okay, so you can go through from the glycogenolysis, glycolysis, and gluconeogenesis. That is important. Other than that, you can study a bit from lipolysis, the cyclooxygenase pathway, because they are asking some question like on the mechanism of action of NSAIDs. So in that context, you can just simply go through from that topic. Okay, you just need to bring a hard copy of your appointment detail, which they have already emailed you. Dr. Sangeeta, you may wait till tomorrow because I remember I received the email a day before the exam. So don't worry, you have time. Okay, from physiology, you just need to know what are the physiological changes during pregnancy, what are those adaptation. For example, there are just few points from the adaptation of CVS, respiratory system, renal system. I think there are some flow charts in the Oxford. In the physiology chapter, at the end of that chapter, they have just listed those points. So just it hardly takes 10 to 12 minutes. You can revise that. Uh, I don't think so because I think you are asking about this slide. I actually added this one. So I have added doctor in front of my name. Yes, you can take a print of that confirmation email because it varies from center to center. Sometimes they will ask you about the confirmation email hard copy. Sometimes you can show that your email on your mobile phone, but to be on the safe side, it is better to take a hard copy. And sometimes they don't even bother this email. They won't provide you with the calculator. It is not allowed in the exam. But yes, they will provide you with the pen and the paper. And they will offer you a glass of water as well. No food. No food is allowed. Dr. Sadika, you can, if you want to, if you want to have a little break, you can simply ask the coordinator, and they will allow you to leave the examination room. However, if you are taking that break between your exam, your time would be deducted. Okay, I haven't seen any calculator in the computer because you just have a single screen and which is your exam interface. And I remember there was no calculator in the system. If any of you have found that calculator in your computer, please do let me know. I don't think so. There's a calculator. Recently, I have given an exam, which is known as Watson laser test, which is all about the biostatics test and calculations and everything, and there was no calculator. Don't worry, same here. Honestly, I believe the maths is a curse for medical students. You can do your calculations on the paper with the marker. But the calculations are pretty straightforward. You can, if you have practiced enough, you can easily solve those biostatistic questions. That's a good question, Dr. Muskan. You can simply ask for the water or a cup of tea or a coffee. Yes, you can skip the break. It's all up to you, but I recommend to take utilize that break. Yes, definitely. The questions you are not sure, you can skip those questions, and at the end, you will have the review screen, and the questions you have skipped, you can solve those questions at that time. There is no negative marking. Okay, it's a computer-based exam, so you have to mark on the computer. Okay, the food is not allowed in the examination room. You need to keep everything in the locker. But yes, during the break, when you come out from the examination room, you can open up your locker and utilize your food or chocolate or anything. But again, if you're going back into the examination room, you need to keep everything back into that locker. Okay, it would take roughly 1 month. Yes, you can change the answer. Dr. Sangeeta, I think you can go out from the hall, but again, it depends on the Pearson Center you are writing your exam because sometimes they have their own policies. Sometimes they let you go out, sometimes they don't. Yes, you can leave before, once you're done with your exams, yes, simply you can submit your exam and left the examination room. Yes, Sangeeta, you can change your answer anytime before the closing of your exam. Dr. Imad, it is hard to say how much percentage is going to be there, but yes, roughly half of the questions would be you find similar. Yes, with both papers, you can do the same, but yes, individually. Once you logged your paper one, there is no way back. You can open up your paper one. Once it is done, it is done. But yes, before submitting your paper one, you can change your answer anytime. But once you locked your exam, then you can not review your paper one. Then you only have your paper two to review. Yes, you will get a paper and a pen. Okay. I think some of you have participated late. So this is your exam interface. And on the right top corner, you can flag your question for review. On the right lower corner, you have your navigators for next and previous click key. And on the left lower corner, you have your end exam prompt or submission prompt. And here in these bubbles, you need to click to mark your question, your answer. Okay, I think we do not have any more questions. If you still have any questions, you may ask me, or otherwise I'm going to end the session. Yes, both papers are separated. First of all, you are going to solve your paper one, and once you submit that question, your paper one, you will offered a break. If you want to take that break, that's good. If you don't, then you can simply move on to your paper B. No, you are not allowed to revise during the break time. Not at all. Yes, the paper is similar around the world. Okay, globally, this exam is held at the Pearson centers. So wherever it is, it might be in the London, in the Sheffield, or in the Scotland, Glasgow, everywhere, they are Pearson centers, and same goes the globally. So classically, this exam held at the Pearson centers. Yes, but you will get a break between paper one and paper two, so you are not going to sit for 5 hours straight. Yes, always. Everyone's in my prayers. Yes, it is quite similar as FCPS part one, but there is a difference in the software, or you may say the exam interface. The interface of FCPS is quite different from the Pearson interface. It is way more organized. Okay, someone asked me how to mark the question. Okay, one more thing. You will get this demo before your exam. They will guide you with everything, like how you're going to utilize these keys, how you're going to mark the question, and how you are going to use your review screen. However, this is just for your reassurance and you just to make you better prepared for the exam day so that you will not feel panicked. Something comes up new to you. So basically, this is how your exam screen looks like, and here are your five options, and you just simply need to click on the bubble, whatever answer you wanted to mark. For in this case, you are going to mark sinusitis, so you need to click on bubble E. That's it. And once you click here, then you need to go next. Yes, it's all up to you. If you want to take unscheduled break during your exam, yes, you can take that break, but your time would be deducted in that case. Okay, on the top right corner, here's a flag for review. You just simply click here. This would go red. And at the end, you will get a review screen on which all the red flag questions would appear, all the marked questions would appear, and all the unmarked questions would be appear. And you just simply need to click on that, and that page will be directed to that particular question. So it would help to save a lot of your time. Okay, navigator is for next or previous slide. If you want to move on to the next slide, just next. And if you want to go on the previous slide, previous. Yes, there is no problem, but it would waste your time. Yes, you can do that. You can stop your exam, and but you need to ask the coordinator first. They will guide you further, like how you can pause your exam, and they will carry you out the examination room. And once you are done with your break, you need to ask the coordinator, and they will take you back to the examination room. So you will be guided all the time. Yes, definitely. Don't take unnecessary unscheduled break. Try to utilize that 1 hour break which is between your paper one and paper two. I think that is more than enough. Yes, but it would risk your exam. For instance, if you are at question number 50 and you took 10 minutes break, and after that you have some difficult questions, or maybe you have some calculations to do, then definitely that is something very risky. Yes, you will be provided with the locker. When you do the initial checks, once your identity is confirmed, they will offer you the locker, and you can keep everything there, and you will keep your key with yourself during the exam. No, that break time is not included in your exam, not. Okay, it is 2.5 hours for each paper, and other than that, you will have the break. Okay, I'm talking about the unscheduled break. The unscheduled breaks are not recommended, but yes, once you are done with your paper one, you will get a break for 1 hour. That is absolutely fine, and I recommend to utilize that break. But yes, once you start your paper B, don't take any other break. Yes, you are not allowed to revise anything there. The books are not allowed. The study material is not allowed. However, even if that is allowed, but I won't recommend you to revise anything during the break time. That is not healthy. Even I don't recommend you to study at the exam day. That is not good for your mental health, especially during the exam. You need a lot of energy, and your mind should be relaxed, and that is not saturated at that time. So try to relax on the exam day. Yes, one there is 1 mark for each question. Yes, there is no negative marking in this exam. Yes, you can if you have done your paper one before everyone else, and you took that break, and again, yes, it's all up to you. If you want to start your exam right away, you can. Yes, you need to pass both papers. Okay, so there were a lot of queries, and I'm glad that I try my best to address those queries. However, good luck. You are well prepared, and trust your hard work always. Even during if you are solving the exam and you feel that you are overwhelmed by the exam, try to recall that hard time, the time you have spent on studying. That would motivate you in solving the exam. Yes, you can use your mobile phones during the break time. Yes, you need to pass the paper individually. Okay, so good luck again, And I would like to conduct another live session or your exam day, and we will celebrate your success together. Goodbye.